Good morning, afternoon, and evening to all joining from around the world. From Vision Science Academy, myself, Christy Sharma, Education Engagement Manager, welcome you all to our exclusive webinar, the Vision Science Talks for the month of June 2025. I'm happy to inform you that today we are joined by an enthusiastic group of students from Saudi Arabia and Africa. I'm extending a warm welcome to all of these students to the Vision Science Talks, and I hope that this becomes a valuable experience to all. A brief insight about us. Vision Science Academy is an advanced education institution headquartered in London, United Kingdom, with a global audience base of more than 20,000 individuals, increasing even at this moment. We are licensed by the Information Commissioner's Office, United Kingdom, endorsed by the Glasgow Caledonian University, and our education is supported by Microsoft. For this webinar, the premium members of Vision Science Academy will be earning 2 knowledge points and a complimentary certificate of attendance. For our non-premium members, the certificate of attendance is available on request for a small processing fee. Keep an eye on our chat box for more information. Also, we offer a number of exclusive courses in our Vision Science Academy Learning Center. Check out this video to have a glimpse on the online courses at VSA.
Welcome to the Vision Science Academy Learning Center, where eye care education meets innovation. Explore a curated mix of video and text-based courses, all crafted by leading professionals in the field. Study online at your own pace. Anytime, anywhere. Get certified, enhance your skills, and boost your clinical confidence with every course. Join a global learning community driven by passion and led by industry experts. Start your learning journey today.
If you are interested to enroll into any of our courses, head to the link provided in the chat box for your reference. On successful completion of these courses, you can earn a career certificate from Vision Science Academy. At the outset, I request our attendees to keep your microphones and cameras off at all times during the event. In this discussion today, we will learn and enhance our knowledge on the sensory impairments that affect a large population of the world in terms of daily living. Not all impairments are solitary. Some can be a combination of even 2 different types of sensory impairments, making life even harder to navigate. This brings us to welcome our expert speaker to share her insights on vision and sensory impairments with us. Dr. Nayan Gupta is an accomplished optometrist, academician, researcher, and clinician with expertise in binocular vision, specialty contact lenses, pediatric optometry, and neuro-optometric evaluations. Over a decade experience in optometry, currently working as an assistant professor at the School of Allied Health Sciences, Galgotias University, Greater Noida. Dr. Gupta integrates innovative teaching methodologies, mentors students, and contributes significantly to optometric education and research. With extensive clinical experience, including time at Shankar Netralaya and her specialty clinic iVed, Dr. Gupta excels in advanced diagnostics and patient care. Her research spans mental well-being, vision therapy, and neuro-optometric rehabilitation, with multiple publications in international journals. She is actively involved in organizing academic events, delivering expert talks, and fostering interdisciplinary collaboration in vision science. A fellow of the American Academy of Optometry and a recognized leader in her field, Dr. Gupta continues to shape the future of optometry through education, research, and clinical innovation. A gentle reminder here for our audience, if you have any questions for our speaker, please put them in the chat box and we will be addressing those during the Q&A session. Over to you, Dr. Nayan, and a warm welcome to the Vision Science Talks.
Thank you so much. And it's a pleasure for me to be here today and address the budding optometrists and to the very important topic, which is, taking up hearts today in today's scenario. I thank you for the invite and I feel great, to be here today to share my experience with you all in the month, especially which is dedicated for the awareness of deaf and the blind. Today, we are going to explore a topic that's often, overlooked, but deeply impacts millions of lives, vision, and sensory impairments. So the presentation, as you can see, that is titled as Seeing Beyond the Sight, because, vision isn't just about what the eyes see. It's all about how we perceive, how we navigate, and connect with the world around us. By the end of this session, I am very much sure that, all of us will be walking away with a deeper understanding, greater empathy, and actionable ways, to foster the inclusion of this very important topic. Let's begin with a moment of reflection, because it's a very powerful reminder that seeing isn't just about eyesight. It's about how our brain is going to interpret, and for millions, the processes work differently. For each and every individual in this world, I believe, it is going to work very, very different. Today, we are here to talk, about the vision and the sensory impairments, not just as we talk about a medical condition, but as a human experience that is shaped by the world around us. Considering, over 2.2 billion people who are globally having visual impairment, that is, according to WHO, 1 in 4 of us. But isn't it a real tragedy? I feel many faces, exclusion that is there, not because of their disabilities, but because of our lack of the accessibility that is there. Also, we will be discussing in today's presentation about the various types of impairments, because it is important to understand the diversity in which is the first step when we talk about empathy. There are assistive technologies which are there, and the tools that turn barriers into bridges. It is very essential. And then we will be discussing about the practical ways each of us that we can make a difference in the scenario. So this is not just about awareness. It is also about rethinking how we design, how we communicate, how we interact. So everyone is free to participate, and let's get started to understand a better scenario. So the very first section of today's presentation, I'm going to talk about, the basic understanding about the vision and the sensory impairments. Look at this image side by side. If you see, there's a normal vision, which is a sharp, clearer image. And if you see where the details and everything is visible, on the other hand, there is a blurry vision, or which we call, the hazy vision, which is their foggy vision. So, this is the daily reality of millions of people that are there. Also, during, when we talk about this entire spectrum of blindness, low vision, blindness doesn't always mean, when we're talking about the total darkness. Sometimes perceiving, light or shadows, others see nothing at all. However, if we talk about legal blindness, this is defined as vision below than 2200, meaning that, when a sighted person sees clearly at 200 feet, a blind person must be within 20 feet to see that particular distance. And as we know, a low vision defined significantly, which is, the WHO classifies the visual acuity of less than 618, then the visual field. So all of these constraints, all of these parameters help the practitioners as optometrists to us, to classify these individuals into their categories as defined by visual impairment. And if you further look forward, visual impairment is further divided into 4 very categories. Now, here is what is critical. When we talk about visual impairment, these could be congenital and these could be acquired, which are developed later in life, right? So, identifying the patient and prescribing them with the right type of aid that is necessary is very, very important. So, how do we actually bridge this particular gap? That is where, innovation and empathy are going to come together, and we are going to explore the next in today's generation, when we are talking about technology, which is immersive, right? We are talking about, AI coming into picture. So why aren't we applying technologies, and why aren't we, providing enough to and helping our individuals who are there with visual impairment? Why don't we bridge this gap between these individuals by providing them support, by providing them the correct type of referral, by providing them actual some empathy that is required from our end. If we talk about, behind every, if you look at patients closely, every visual impairment, there is a story. And that is often rooted in terms of biology, if I would say. If you see that, cataract, if you talk about, the cloudy lens, so that particular, the eye's natural lens clouds over, there's a blurring of light, the color halos are seen by the patient. And cataract surgery is one of the modern medicine miracles, which we could say that often restores the vision in 100, right? In an hour. In hundreds of people, you can do that, in an hour's time, one patient, you can get rid of that particular visual loss that the patient is having. If we talk about glaucoma, which is also called as the silent thief. So glaucoma that doesn't knock, it creeps, it damages the optic nerve, often starting with, the peripheral vision loss. And by the time you notice, it is definitely an irreversible harm that is done. But with early detection, I believe that its progression is definitely slowed by the use of the anti-glaucoma medications, by the various investigations that are done to help these patients. And vision tests are not just, it's not just about the clarity of vision we'll be talking about. It's also about prevention. That's why we say that, every 6 months an eye checkup is necessary. Why? Because we are not just always checking about the clarity of vision, but we're also bothered about, its prevention. We're bothered about the, how we can help the patient. However, when we talk about diabetic retinopathy, which is, yes, sugar's shadow, it's a harsh truth that, uncontrolled diabetes literally eats away your retinal blood vessels. Patients may see floaters or, sudden blackouts, and that is the scary part of it. 1 in 3 people with diabetes, yes, they develop this. But with tight blood sugar control and, annual eye examinations, blindness is often preventable. This is why, optometrists, even the endocrinologists should be your best friends, because, they keep you guiding, when you need to check your blood sugar levels. Are you actually monitoring them or not? In today's busy life schedule, most of us, miss it. And trust me, nowadays in OPDs, we also see juvenile cases of these patients reporting to the clinic with severe kind of impairment. When we talk about, the retinal retinitis pigmentosa, which is genetic, yes, the world gets narrower. The genetic disorder is like, it's walking through a tunnel that slowly closes, right? First night blindness, then peripheral vision loss vanishes, leaving many with just, a keyhole kind of sight that the patient has. So all of it has to be monitored, and yes, eye exam becomes a very crucial step there. And we as optometrists are the primary eye care providers at this point in time. When we talk about, sensory impairments, definitely, impairments which span for beyond the sight, which is affecting, hearing, touch, balance, and even, sometimes the internal body's vestibulo-ocular reflex. So let us explore, these often overlooked challenges that the patients face. Hearing loss, which is one of the major factors which affects the communication of a patient. Hearing loss is not just, a patient's volume that is turning down, but imagine, trying to follow a conversation where the patient's words, sounds are muffled. Like the patient is not able to understand, like, somebody who's underwater, like we hear underwater, something like that, right? As per the statistics, the 466 million people globally, with disabling hearing loss as per the WHO. This is the daily life of these individuals. And it is not just about when we talk about missing sounds, it is about the social isolation that these individuals face. Because, that follows when the communication breaks down over. Think about this, how many of your workplace meetings are truly accessible to someone who, if you're just maybe in today's conversation, if I'm just lip sync, are you able to sense enough if I'm just making my lip readings and or uses some sign language to communicate to you and to make you understand about these very sensitive impairments, right? I believe it is not that easy. So each sense that we talk about, sensory impairment when we talk about, it's very crucial. Moving towards the second type, that is, the tactile sensitivity, where, the touch sensation that is betraying the individual. For people with diabetes and or any other kind of neuropathy, if we say that, a light touch, can feel like sandpaper or even worse. They might not feel a foot injury until, it becomes infected or if it is highly inflamed. And this isn't just about discomfort, it's about the safety risk as well, because the wound was left uncovered for a pretty long time. Imagine, not knowing if you have ever stepped on a glass under you, and after that, you just observe that there's some blood oozing out of your finger, of the toe, right? So that is how these sensations, I would say, these diseases impact these tactile sensitivities. And these all collectively become a part of the sensory impairment. Moving ahead, when we talk about, the vestibular disorders, we talk about the world on the tilt. We talk about, closing your eyes and spin in a place for 3 times, for example. Don't you feel dizzy after that? Or maybe, so you sit on a revolving chair and somebody rotates you for multiple times. And what happens to you? Definitely, there is dizziness, there is a bit of disorientation that is there. For those with vestibular disorders, it never stops. Or this kind of disorientation is persisting over a period of time. The inner ear damage, can make the floor feel like, there is a rocking boat that is 24 by 7, which is stimulating continuously. And these simple tasks like, when you bend to tie your shoes, a patient can feel nausea. They will have issues in the balance, or they will have disorientation after that. Getting up from the bed immediately is a very common complaint of the individuals who have these kind of vestibular disorders. So in today's class, we're not just talking about, the visual impairment that is there, but I would like to focus more on when we are talking about the sensory impairments that are there, which include all of this. When we talk about deaf and the blindness together, the multi-sensory impairment, Helen Keller is famously said, the blindness separates us from things, but deafness separates us from people. I would like to quote this very famous quote by Helen Keller. And for those, with MSI, that is the multisensory impairment, both worlds shrink simultaneously, yet with tactile sign language that is there, that guide communicators, or maybe you can call it as, adaptive techniques. That is the connection that is possible with these individuals. If we talk about the global perspective, putting up the numbers together, the map isn't about, just looking at, okay, the population growth of even North America, when you combine that with Europe, if you look at representation that there are 1 billion people living with preventable visual impairment right now, and 43 million people are blind, yet WHO estimates that 80% of the cases could be prevented or could be treated. Think about that, for a moment, these people could be treated 80% of the cases. So millions are needlessly losing sight from cataracts, maybe some infections or uncorrected refractive errors simply because they lack access to the care. When we talk about this rising tide, aging population, which is linked to the rising threats, by 2050, age-related macular degeneration, even glaucoma cases will double as a baby boomer growing older. But here's a catch, that these conditions are silent. You won't feel your peripheral vision slipping away from glaucoma until it's too very late. So, how many of you as, optometrists, you can participate in screening camps and help coming this to reduce this very stats that is there. So how many of you and your parents maybe are over 50, and this isn't a them problem, it is definitely an us problem together. Why? Because we are the primary care givers. Definitely talking about about the next session of the today's presentation about living with vision and sensory impairments. Definitely imagine an individual, there is a bustling street, noisy, chaotic, full of obstacles. For someone with vision or sensory impairment, this isn't just that inconvenient. It's not, because break down what these challenges look like for these individuals every day. Definitely, mobility is an issue for them, navigating an unforgiving world. You know, how many of us, notice whether our streets have tactile paving, or, if there are curb cuts are actually aligned with the crosswalks. So these small designs, flaws can have life-altering consequences, and these can help many. Information access, the digital and the physical divide. Now, think about your morning routine, checking your emails, you read signs, scan a menu. For many, these tasks are blocked by websites that lock out the screen readers, like, there is a store with a no entry sign for 15% of the global population. Printable materials without braille or any audio alternatives that are there. So forcing reliance or any other, on others for basic information that the patient is relying, right? So we live in this particular digital age, I would say, yet, the accessibility is the market around, we do not have all of it, right? Social barriers, yes. If we talk about the weight of the low expectations, the most insidious challenges aren't physical, but they are the attitude of the individuals. Well meaning phrases like, let me do that for you, strips away the independence of an individual who is, sensorily impaired, right? That person doesn't want to nowhere depend on anybody, right? So be imagine, these people are visually impaired individuals are being capable, but constantly treated as helpless. Why? We are the individuals who are going to bring in change for them. So about respect, it's asking, how can I assist you, instead of assuming that they will need assistance, right? So that is a change that we all individuals can bring forward. Talking about the assistive technologies, imagine, a world where barriers begin to dissolve, not because disabilities disappear, but because, when we talk about innovations that rises to meet them. The tools you see here aren't just gadgets. They are the keys to independence. And let's explore how technology is rewriting the rules of accessibility. We have screen readers, right? The digital life of, that is having a voice. So for blind or even individuals with low vision users, the screen readers like JAWS, NVDA, which is a free and open source, Apple's voice over transform text into speech, or even the Braille output. Think of them as navigational co-pilots for the digital world, reading emails, describing images, even, even the announcing buttons. But here's a catch. not all the websites work with alongside these softwares, right? Every encountered or an unlabeled graphic, or that says prove that you're not a robot, right? For a screen reader user, that's like hitting a brick wall. It's very difficult for these individuals to overcome all of it. So that is the reason when we say the accessibility is quite low. We talk about braille. We say that braille tech, the literacy which is there at your fingertips. Braille isn't, it's evolving, right? Devices like, if you talk about Orbit Reader, uses tiny pins to refresh the braille dynamically. Imagine reading a textbook or a text message or even coding line by line under your fingers. For the deaf and the blind individuals, that isn't just convenience. It's their lifeline to communication. Yet braille literacy is, declining due to the cost and training gaps. That's a problem because no one should have to choose, between speech and literacy. There are variables, the future on your face, the OrCam My Eye, which is a tiny device that clips to your glasses and reads the text aloud. If, for example, any menu cards, street signs, and even your friends' t-shirts, slogans, or whatever coming in view of that particular camera site. We have e-sight, that is an electronic glasses that amplify the remaining vision for people with low vision, turning blur into clarity, right? So all of these technologies are assistive, yes, and the only thing that lacks is, the accessibility of these technologies. We talk about guide dogs. We talk about which is guide dog, which is more than a pet to an individual. These dogs undergo years of training to navigate complex environments and avoiding obstacles, stopping on, at the curbs, and even, disobeying the unsafe commands. They're not just the GPS systems, but they don't, take directional orders like turn left. Instead, they are trained to think critically, ignoring the distractions and prioritizing their handler's safety above everything else. So the dog is going to guide you, take you there, right? So here's a crucial rule: never pet a guide dog in harness. That harness is their work uniform. Distractions can put their handle in danger, definitely. We talk about white canes, a symbol of independence. One of the oldest and the most powerful tool of independence, if you talk about for the visually impaired. But did you know that, colors as well matter? So there are red tipped canes, which are typically used by someone who is fully blind. And there are white tipped, canes, often signals that low vision or the patient has, a partial sight that is there. Okay. So two different types of canes that are available. And yet, how often do we see someone with a cane and assume that, okay, they need help rather than asking first? Independence isn't about, that they're refusing for assistance. It is about having the choice of choosing it, whether they want it or not. We talk about innovation. We talk about, high technology. Sometimes the most powerful solutions are very simple. It is just the everyday adaptations that we need. What you see here isn't just a modified microwave, or, it's just a testament to a human creativity in the face of challenges. Let's explore how, each small challenge can make life more accessible. At home, there are small tweaks, big impact. Imagine trying to distinguish between a similar clothing item like black socks or a cane goods, without sight. So simple fixes like, rubber hands on labels, or there are textured stickers that help these individuals for their independence. And there are tools like, talking thermometers. So all of this becomes pretty much, comfortable and adaptive to these individuals. For navigations, we have discussed a lot, but counting steps from the elevator to your door, memorizing, the exact number of the tiles in a hallway, using landmarks like the pharmacy next to the bus stop to orient oneself. This mental mapping isn't just a skill. Trust me, guys, it is not just a skill, but it's a labor, and it's very fragile. Individual, it's very difficult for these individuals. Once they are rearranged, store layout or a temporary construction barrier, that can unravel weeks of learned routes that individual has kept for them. So it's not that simple that we look at. The adaptation, the technique that requires a lot of hard work. Raising awareness and advocacy when we're talking about shifting the mindsets from pity to respect. We're talking about awareness. We're talking about the awareness that dismantles the inspiration narrative, the idea that people with disabilities are brave just for their existence. True respect means, seeing these capabilities and not just struggle. It's about, difference between let me do that for you and how, you know, can we make this accessible together for that particular individual. When my friend who used to use a wheelchair hears that, you are so inspiring for going to the gym, what she actually hears is, I didn't expect you to have a normal life. So awareness is, rewriting that particular script for most. So disability, I would always say that it is not an inability, it's the diversity. There are policy changes, the awareness as a fuel of action, I would say. Various, policy makers, the policies are there that are existing and that help these individuals, to register and then, come back. If we talk about the famous figures, we talk about Haben Girma, the lawyer who rewrote the rules. The first deaf and the blind graduate of the Harvard Law didn't just attend law school, but she forced it to adapt. She used, digital braille display and a keyboard to communicate, proving that, accessibility isn't just accommodation, it's about opportunity. When she says this, disability is an opportunity, it's her saying that disability is an opportunity for innovation. And she is not being poetic, but she's describing, how she used to measure, how she used a major corporation for the web in accessibility and, then won. A man who touched the sky, the Eric, blind since 13, and yet he climbed the Everest, not in spite of his disability, but by reimagining the teamwork. His guides use verbal cues and rope signals, turning impossible into a summit selfie. So this is something which is, really touching and really something which we should be doing for our community. We talk about Steve, you know, and of course he is, American and a Ghanaian singer, songwriter, and a musician. Blind from infancy, yet his music transcended the sight. Helen Keller, we all know that her sayings, we all know, right? So ask yourself, are we building ropes, ramps, or are we creating roadblocks for these individuals? Are we blocking their roads, right? Behind every leap towards accessibility, are organizations who are doing quite relentlessly, working towards the change. And these groups don't just, talk about inclusion, they build it brick by brick. And let me, make you understand this in a little detail about one of the organizations, that is the Advocacy for the Braille Literacy, the National Federation of the Blind, USA. isn't just about advocacy, it's about redefining the expectations. And they fight for the braille literacy in schools because 1 in 10 blind children today learns to read braille. So let that sink in. And in the world of audiobooks, braille is still a literacy, and literacy is definitely power. Another one organization, that is RNIB, Royal National Institute of Blind People. This is United Kingdom. Across the pond, the RNIB, runs the Talking Books Library. Over 30,000 audiobooks free for visually impaired readers. And, but Shakespeare, we talk about big authors, even the latest bestsellers, all are accessible with a special kind of library card that they issue, and that is accessible. So, but here is the kicker, it's not, just remember, it's not charity, because stories shouldn't have barriers, definitely. And these companies are striving hard to help these people see differently. Even Lighthouse is promoting that. This organization merges vision with action, literally. They pair eye care with technology, tech training, proving that a screen reader lesson can be as vital as a glaucoma check. And this is the mantra that they use: see what is possible. So that's not inspiration, but I would say that's all the infrastructure that's existing to help these individuals. We say that, the power of asking, ask before assisting. A simple, if you could say that, would you like help? That respects the person's autonomy. So never assume that someone, needs or wants your intervention there. A colleague once told me, I would rather take 5 minutes to figure it out myself than, feel infantilized, because you're not going to baby spoon that particular individual. Independence isn't also about speed. It's also about the self-respect. It's also about the dignity of an individual. Art of description is another. Use clear verbal descriptions when you're talking to these individuals, I would say. Specify the clarity. The problem with the assumptions is, like, sometimes it is often said, grab someone's arm abruptly, and you sudden contact and disorientating that person, and that becomes really difficult for that person. So if guiding is needed, offer your elbow and let them take it if they want it, right? So these are few gestures that, as individuals, all of us should be practicing. So that is how, we can make a difference. Talking about accessibility, and then talking about, inclusion. Definition, if we talk about, yes, designing products, environments to be usable by all people without adaptation. Yes, equitable use is very important. We talk about flexibility, it's very important. We talk about simple, intuitive, that is also very important. The signage, the voice prompts, that is all very, very important. Talking about the accessible public spaces, the tactile ground indicators are one essential of it, if we talk about it. And if we talk about the audio signals, the beeping crosswalks with vibration that is well installed in Japan and places, a few of them in US as well. Why all of this digital accessibility, matters? Because imagine trying to pay a bill, apply for work, or even, order food online, but the website literally won't let you in. For a screen reader user, that's the reality. So each of us, we are well educated, that we can help these individuals, shape their career, right? audio signals, braille. There are various global examples that are there. When we talk about their inclusion in education and when we talk about their employment, right? Students that isn't just learning, they are rewriting, the narrative of what's possible. But here's the truth, access to education. Were they allowed in school, the normal school or not? Employability. It's not about charity that you're giving them. It's their right. It's their birthright to get it, right? So imagine trying to learn algebra without seeing equations or without science, without the lab, the diagrams, the pictures. For students with visual impairment, tools like braille textbooks, even tactile graphics and screen magnifiers aren't extras, so they are the lifelines to knowledge. Tools alone, they are not enough. Yes, we need specific teachers. We need trained teachers who help these individuals. And University Design for Learning, UDL, a framework that adapts lessons for the diverse learners that is existing. If we talk about workplace, we talk about accommodations, that is equivalent to innovation. The unemployment rate of the people with disabilities is double the national average, not because, they can't work, but because the workplaces won't adapt. And JAWS software for screen reading, adjustable lighting for light sensitivity individuals, remote work options for those who have mobility challenges. All of these are, very easy ways, to help individuals. And Microsoft, they have a lot of success stories with these individuals. So when we design, classrooms and when we talk about workplaces for edges, everyone benefits. Curb help parents with strollers. So closed captions help gym goers, and inclusion isn't a cost; it's an ROI multiplier, right? So that is how we all should be inclusive and helping these individuals to come out. When we talk about experiencing the world differently, let's get one thing straight that disability stimulations don't make you understand what's like to be blind or deaf, but what they do reveal just how hostile over everyday environments can be. Let's try an experiment and understand if you are preparing a blindfold meal, just you can try someday out. How does it feel like? We do such activities sometimes with our university students as well. Some event wherein we especially during the World Sight Day celebrations, the blindfold meal, the people have to taste and then they need to prepare the meal, identify the food by taste or by texture. Close your eyes and now imagine, you what type of snack you are having or what is that ingredient that is there, right? So this isn't about, walking in their shoes, but it's about realizing why we need tactile food markers or descriptive menus. There is a need, definitely, yes. We talk about audio only navigation, finding objects using the verbal clues. So we used to play such games, right? You are blindfolded and your friend is guiding you to hold that particular object, or you are asked to navigate through that particular roadway, right? So the key insight is here that barriers is not, the disability. It's not equivalent. So these stimulations aren't also about pity. They spotlight how our design, our unclear signage, our cluttered walkways create this disability. So we are the one who are creating that. It's not existing. However, if we are somewhere providing support, fix the environment, not the person. You're not, nobody to say that, okay, this has to be like this and this will continue to like this. I think a proper referral or, guiding an individual to the right path will also help, right? So what's one barrier you will notice? And that is what you are dismantling after today. Art isn't about something we see, definitely. It's about something we feel, experience, and even reimagine sometimes. This piece of art isn't just accessible, it challenges the very idea that creativity depends on sight. So let's meet with this artist and spaces rewriting the rules. John, he's the blind artist. He used textured paints to color by feel, who lost his vision, as an adult. And these paints are so vibrant, textured masterpiece by feeling his canvas. He mixes paints, with different viscosities to color by touch, creating bold portraits that explode with emotion. So his secret, I don't paint what I see, is I paint what I feel. A reminder that art is definitely universal. Another, uh, you know, one of the other scientists, Ashraf, that is born to blind, and yet his paintings capture perspective, shadows, realism with shocking accuracy. He uses, raised lines, sketches, and verbal descriptions to construct mental images that translates them onto the canvas. So that is how they are breaking the barriers, and these artist exhibitions, where the creativity isn't just stored in the eyes; it is stored in the mind. And we design inclusive art spaces. We don't just include; we enrich these cultures for everyone. Talking about the various myths and misconceptions, right? Uh, they aren't just harmless assumptions, they shape the policies, they help to design the lives and ready for some truth bombs as well. Reality, if we talk about, most have some vision, light perception, blur, or maybe the tunnel vision. Saying that see you later isn't offensive, but assuming everyone's experienced blindness the same way, that is the problem. So vision is a spectrum, and I would say that is not an on and off thing that you're able to see and not able to see, right? So many perceive, light, shadow, or a partial vision, and that is a fact. And voiceover, talk back, making phones fully accessible. That is how, they're able to navigate. So they aren't huge commitments and, just human ones. Whether it's 2 minutes on a call or 2 hours of walk recording, a recording of a week, you can bridge these gaps you never knew that also existed. When we talk about how we can help them, we want to turn dollars into real world impacts. Let's talk about, how your generosity can open the doors, literally. And this helps. Every contribution, if we talk about whether it's big or small, fuels independence and innovation. Very small donations, if you talk about, right? That can also help. Volunteering opportunities. There are various apps like Be My Eyes, recording audiobooks, guiding dog puppy raising. You're helping the dog to train. There, you're helping these individuals out. There are various laws which help these individuals as well, and you can be a part of it and support by donating, fundraising, recycling the glasses for the low income countries, raising funds for the retinal disease that is research that also helps a lot. Policy advocacies, when we talk about, we're talking about the ADA, the Americans with Disabilities Act, that requires public accommodations. We have several, uh, organizations that are coming up that help these individuals. We talk about the mind-blowing technology that is coming up. right? So the UNCRPD, that is a global treaty for disability rights, ratified by 195 countries, not the US, that's going to help. Definitely, your voice is going to matter, whether it is local or whether it is national. If you talk about petition for tactile sidewalks or audible crossways in your neighborhood, that could be one example. If you talk about, demanding audio descriptions on Netflix or any other entertainment, that shouldn't be exclusive, right? So the future isn't just coming, it's here. And let's explore, there are various technologies which are revolutionizing the independence of these visually impaired. The AI powered navigation, seeing the AI Microsoft, which is a free app that does not just read text, but it also describes the world. It scans the currency, it recognizes the faces, and even identifies the colors and the lighting. We walk smart cane, which is a traditional cane, misses overhead hazards, right? Like tree branches or maybe the open cabinets. So the V-walk can is uses the ultrasonic sensors to vibrate when the danger lurks above. So it's like giving the white cane, you're giving them a sense that is there, right? Mind blowing medical tech, that is the Argus 2 retinal processes. The bionic eye bypasses damaged retinas, sending visual signals straight to the brain. And users see flashes of lights. They learn to interpret as a shape and a movement. And one patient even, rode a bike with it. So these all innovations, blow our minds out. So which one of these excites you the most, right? So you as optometrist, budding optometrist, you can, participate, in these research programs. You could help fund, advocate, and even invent the next breakthrough that can, help these individuals in a right way. We witness, a coming era in vision science. We talk about where doctors aren't just treating blindness, but reversing it. So let's, talk about the breakthroughs, rewriting the medical textbooks. The first FDA approved gene therapy for the kids, that is the RPE65 mutation, right? That is one. We talk about stem cells trial. The scientists are growing optic nerve from these stem cells, and early trials have even showed damaged retinas repairing themselves. So we are not there yet. But imagine a future where glaucoma isn't permanent, it's fixable. It could be possible, right? The gene editor, right? Scientists cut and paste the DNA like fixing a typo error that we do. So trials are underway for the Leber's congenital anomaly and retinitis pigmentosa, and one-time treatment that erases the blindness at the genetical level. So these treatments exist, but the SS is next battle, because the cost factor would be so high, and then again, is it that successful, right? So we will, uh, awareing your patient, giving them the hope that yes, something is possible. We make sure everyone gets a chance, to actually know what is existing. So it's our right, that to help our patients, to guide them appropriately, and do a lot more for them. As we wrap up, let's revisit and talk about, vision loss, right? Low vision to total blindness, and many cases are preventable with access to care. For instance, if we talk about diabetic retinopathy, that can be managed with regular screening, right? True inclusion isn't just about bringing up ramps and the braille into practice. It's designing the space, it's designing the tools, the policies with the disabled people, because they are the one who will be able to understand it. We will not be able to understand and help them far. So think, how would a blind person use this website or navigate this particular building, if at all you are get a chance to do that, right? Change starts small. I always, this is one of the very common saying, that change always starts small. You could even download the Be My app, Be My Eyes app, to lend your sight remotely or audit your workspace. for accessibility gaps. And, maybe find out, being a researcher at this age, you should be keen to dwell into these um, technologies and, understand how we can improvise, what next we can add, how can I contribute. And, each one of us contributing would make a huge difference. So change starts with you, but it doesn't require, grand gestures, right? So run a free, maybe accessibility scan on your website. Try navigating your phone with voiceover, just voiceover, blindfold your eyes and try doing that. You know, uh, I think we can give our time this month, volunteer with the local organizations, blind organizations who are working for them, and voice your concerns, advocate for the tactile parts in the public spaces, train your teams, train your groups, to help these individuals, share your reviews and, views with these big organizations and even WHO. Once you report something, definitely there is something that we can do. So which comes to the end of the talk, and I'm happy to take any questions that are there. Thank you so much for your patient listening.
Thank you, Dr. Nayan, for such an insightful presentation that truly justifies the Deafblind Awareness Month very beautifully. I am sure our audience has gathered invaluable knowledge on sensory impairments from this talk. I open the floor now for the Q&A session, and I request Dr. Nayan to please keep your camera on for this session.
Yeah.
So if anyone has any questions for our speaker, please drop them in the chat box. Meanwhile, I am going to put out the questions that we had recorded in our registration process. So our first question was, what ocular problems have you observed in hearing impaired children in your clinical practice?
Okay. You're talking about my practice. When we talk about hearing problems, there are people with autism, there are people with ADHD who have been reporting, with hearing problems as well. So there are one or two syndromes which I had even seen in the clinical practice. Like one of them was an lenticonus, anterior lenticonus that the patient has, often referred to as Alport's syndrome. And there the individual had progressive, I would say, hearing loss, and that was neural related. So that is one disease that I could remember as of now. Even patients with these autistic kids or ADHD kids, sometimes they report with hearing losses, including individuals with Usher syndrome, retinitis pigmentosa, where there are lesions with retinitis pigmentosa as well.
Okay, so the next question is something very related to what you just now said. So our attendee basically has a brother with Usher syndrome. So they wanted to know, is there any treatment for retinitis pigmentosa?
Okay. So maybe I'm not the right one to talk about, the treatment options for Usher syndrome. But yes, what so far I've observed in my clinical practice, that requires a multidisciplinary approach, wherein you will have to treat a patient for their hearing loss management. You have to talk about the patient with, visual impairment, with few visual aids. Definitely nutrition also plays a very crucial role there. Vitamin A, antioxidants, even as we were talking about the Argus-2, the retinal prosthesis, which is almost in the later stages of research, will somewhere help. I would recommend I recommend it for a detailed examination, and yes, with a team of the multidisciplinary team, which we will support, you know improving the patient's quality of life, treating it, thinking about, getting it back to normal. uh, I think we shouldn't think about that. However, we should think about how we can improve the patient's quality of life. I think that is something which is more important, more relevant, rather than saying that, okay, it is treatable or not.
Thank you so much. That was a very great answer. And we hope everyone who is attending this webinar gets that information well. So our next question is some examples on budget-friendly options for assistive electronic technologies.
Okay. There are various, like if you talk about bar reader, that is one easy, right? Simple canes are there. A lot of existing technologies are there. To name a few are these. And I believe if you can register with the appropriate organizations, definitely a huge discounts are also provided for these particular kinds of canes.
All right. So we have another question which may not be directly linked with the topic here, but anyhow, I'll ask it. So the question is effectiveness of presbyond laser and camera lens for presbyopia.
Can you come again?
Yeah. Effectiveness of presbyond laser and camera lens for presbyopia.
Okay. I would come to this later, but before I was just somewhere thinking about the previous question. Uh, I spoke about canes. I spoke about the readers and all. The very simple example is mobile phones, right? We all of have, right? So using that mobile phone, using the function of speech allowed option, that is one very easy thing that we can do. We can easily put color identifiers, in the kitchen. That simple modifications, home modifications that can be done. And definitely like learning braille and all, sometimes bringing up braille books and all is expensive, but audio books are available, various podcasts are available, so that would, I think, help. I think that was the answer to the previous question. And I'm not sure about the press bond lens that you're talking about. I'm can you come up with the question again? Is it about presbyopia correction?
Yeah, it's presbyond laser and camera lens for presbyopia.
Okay, I'm not very much sure about it.
No problem. So those were our pre-recorded questions. Okay, so we have one more question now. What do you think if a patient with vision impairment is a special child? How will you approach? How will you create awareness about the importance of vision assessment for special children's parents?
Right. So, dealing with these special children is very difficult. You cannot just say that, recording visual acuity at that very go is the key there. No. Assessment in these individuals at each stage is very essential, very crucial. You need to have a tailored approach for each and every individual that you are looking forward to. If you talk about involving a psychologist into picture, involving a doctor, an educator, and sometimes, therapists together for approaching these kids is very important, because you will also need to train the parents, the caregivers, who play a very crucial role in, in treating these particular patients. Definitely look for their functional and the developmental tests as well, testing their IQ levels using various cognitive tests. Check for their language and communication, how receptive they are, how expressive they are with their language, how is their motor skills. Check for their gross motor skills, that becomes very important. Check for their eye movements, how is their reading speed, giving them a newspaper or a magazine or a book to read and just check in 1 minute how many words they are reading. What is their disability with reading? Something that is directly related to the quality of life of that particular person. So that sensory evaluation, that motor evaluation, assessing their saccades, assessing their pursuits is also one of the important criteria there. Because sometimes we will have to prescribe them with prisms, sometimes yoke prisms, because we need to help these patients to navigate into an environment, and if they have some sort of visual neglect, or if they have something which is related to a midline shift, the body shifting towards the one side, all of that assessment becomes very, very crucial, and it's very, very subjective, sometimes subjective. But yes, as experienced clinicians, it becomes easy to rule out these individuals. Very most important thing here is also about their emotional and their behavioral response, right? So that is how the individual is behaving with the peers, how they are interacting, how they are well managing their own emotional levels. That becomes very important, right? So simple training with educators, special educators, become is one of the key over there, right? Different people, if you talk about autism, you will have to see that the patient's attention, you have to see how impulsive they are, right? If you see a person with intellectual disability, definitely their IQ levels, their adaptive behaviors have to be looked forward to. So all of that together needs to be treated well.
Okay. So our next question is, did you give rehabilitation to any special child? Would you please share your experience? Yeah.
Yeah, I did work for a couple of months as in the visual rehabilitation center at LB Prasad Eye Institute, Hyderabad, and it was indeed a very great experience, wherein visual training was given with the help of torch lights and all. Then a motor physiotherapist is there who's going to train them with their motor skills, so that collectively helps. And definitely, there are a lot of job opportunities also that the patient is guided for in that particular center. And it was a great experience.
Okay. So the next question is, according to you, how important is it to include contrast sensitivity in the definition of low vision?
That is, something questioning. I would say that when we talk about contrast sensitivity, we're talking about detecting the difference. The how separated the cones of one individual are. That is what is going to describe the contrast sensitivity of an individual. Yes, definitely, somewhere I think I would not rightly say it that yes, it should be included, but when you are examining a patient with low vision, you know you can definitely, you will have to check it. That is one of the protocols, to check for the contrast sensitivity. Qualitatively check how much difficult the patient has, recognizing the faces and all, because definitions are all something which is theoretical, right? You're going to provide a clinical care to the patient, and that is not what is written in the definition. That is what you're doing in the clinic. It's very different, right? So when we are dealing with such patients, I believe it's not the bookish knowledge that we are carrying with us, but yes, one patient you see, you gain some experience, and then you apply that to others, right? How well the patient is performing, make the patient walk in the dim light and then a bright light, and see how much difficulty the patient is having, right? At the end, it is not about you are categorizing a patient into some particular criteria, but you are actually guiding over the patient uh, to be at the right stage, right? So that is more important than, I would say, than having a definition, and that is all.
Okay. Thank you so much for answering these questions. So I don't see any more questions at the moment. So let's move forward. You can now stop sharing your screen.
All right, sorry.
Okay, so with this, we have successfully concluded the talk here. Thank you to our audience for all the important questions raised, and to our speaker for graciously responding to each of them. This brings me to an important announcement. If you are interested to learn about how optometry can be vital in the domain of forensic science, our video course on forensic optometry is the one for you. You can check out the link to the course provided in the chat box already. If you enroll today, you can avail a special webinar offer and get the course for 12.5 UK pounds, which is rupees 1,250 INR, down from the original price of 25 pounds or rupees 2,500. Also, if you are not a premium member of Vision Science Academy and still want to receive a certificate of attendance for this session, you can reach out to us and avail it by paying a small processing fee. So this brings us to the end of our June special Vision Science Talks, observing the Deafblind Awareness Month 2025. Special thanks to our speaker, Dr. Nayan Gupta, for gracing the occasion and providing invaluable knowledge to our attendees today. My gratitudes to our audiences for joining in on this lovely weekend and learning more, engaging with the community. I also invite you all to our next Vision Science Talks on the 6th of July 2025, observing the Dry Eye Awareness Month, by another expert speaker all the way from Sydney, Australia. Registrations begin today. Visit the link provided in the chat box to register now. Thank you once again for joining us and see you in the next month. Thank you.